Hello. Thank you all for joining us today. I'm Chinazo Cunningham, the Commissioner of OASAS, and I am joined by my colleague, Andrew Heck, who's one of the Associate Commissioners who has been instrumental in helping develop this strategic plan that you are all going to hear about. So just in terms of ground rules, today's presentation is being recorded, and it will be made available on the OASAS Strategic Plan webpage. All of your lines have been muted, and so if you want to share comments or questions, please use the chat function, and we will have a lot of time for comments and questions. I also really strongly encourage all of you to go on our web page for the strategic plan to give written comments and input and questions. We are collecting this information from OASAS staff, from providers, community members, people with lived experience, elected officials, etc. And we want to be able to collate all of that information. And so we have a survey that asks for your input on our webpage. And so please, please, please use that if possible. And you will actually be directed to that webpage, which has a full description of our strategic plan along with the survey to get your feedback, and that you'll be directed there as soon as this webinar ends. Next slide. So today, so thank you for joining us today to talk about our draft strategic plan to get your input. This is what the webpage looks like on the OASAS website, where you can see a review of the draft plan, and you can also click on the opportunity to provide input. So this is a QR code, and if you scan that QR code, it will bring you directly to this web page. And again, at the end of this webinar, you will be brought to this web page. Next slide. So just to give you some background around the strategic plan, so we are required by the New York State Mental Hygiene Law to have a 5-year statewide comprehensive plan that sets internal and external priorities, goals, and strategies. And so what we're doing now, and the process that we've been through in the last about year and a half, has really been to update this statewide comprehensive plan, also known as the strategic plan. And part of what is required is to get public feedback. And so certainly we want to get your feedback. And that helps us to ensure that our priorities are aligned with all of you, those who are impacted by addiction, our providers, our local government units, our people with lived experience, or family members or community members. Next slide. So this is a timeline of what we have been doing at OASAS to really update our strategic plan. We have put a lot of time and energy and thought into this. And so we had our first planning session in November of 2022. So that just tells you about how long we've been working on this. We've met regularly, the executive team at OASAS. We've had half-day retreats to really critically review what we're doing, what we should be doing, changes in the landscape, and how our strategic plan should be reflecting that. So we completed our goals and objectives in December of 2023, and then also revised our mission statement and vision statement. We released the draft plan in May of this year, and clearly this is the process now where we are seeking public feedback. We've also presented this to the OASAS staff as well, and then the plan is to submit the final plan in November of 2024. So we will receive your feedback, and we had a similar town hall with the public earlier this week. So we'll collate that feedback, then make our final edits to the strategic plan, and then submit that to the governor. So again, this has been a long process with a lot of attention, a lot of time put into it. So we really, really appreciate your feedback. Next slide. So this is the revised OASAS mission and vision statements. So the mission of the New York State Office of Addiction Services and Supports is to provide support and oversee a data-driven continuum of addiction services delivered with equity, dignity, compassion, and respect. And then the vision statement is that OASAS envisions that people in New York impacted by addiction will thrive and lead healthy lives. So you can scan this QR code again that will take you to this strategic plan web page, which also includes the mission statement and the vision statement. Next slide. So I'm hoping that many of you have heard me talk about our guiding principles here at OASAS, which are to really embrace harm reduction in all of the work that we do, focusing on keeping people alive, given where we are with such a deadly drug supply, meeting people where they are, so going out in communities and reaching people who are at highest risk of harms associated with substance use. We also were using a data-driven, evidence-based approach. So really, what are the data telling us from across the state about the needs in various communities, and making sure that we use those data to guide our services, our investments, our resources, and then, addressing issues with substance use and with gambling, using evidence-based strategies, so those that we know are effective. And then last, using an equity lens in everything that we do. We know the history of drug policies in this country really have been racist. We need to acknowledge that and to ensure that we don't make those same mistakes going forward. And then when we talk about equity, in addition to race and ethnicity, also we want to make sure that our resources are equitably distributed across class, across the regions of the state, in rural communities, in urban communities, and among populations that are at highest risk, like LGBTQ communities. So all of our strategic plan really reflects these guiding principles of harm reduction, a data-driven, evidence-based approach, and using an equity lens. So the priority outcomes, also sort of the pillars of the strategic plan, are really focused on these 5 areas. So first is the people served and the service outcomes. The second is addiction services system infrastructure, accountability, and the workforce. The third is the reputation, relationships, and outreach, and this includes with communities, programs, and governmental units. The fourth is the OASAS internal infrastructure and processes. And then the fifth is the OASAS staff, leadership, and agency culture. So some of these pillars are external to OASAS, and some of them are internal to OASAS. And so what I'm going to do is walk through each of these pillars and dive a little bit deeper to talk about the objectives and the goals within each one of these. So the first is people served and service outcomes. So the objective is to have a continuum of services that remedies systemic racism and is accessible, desirable, and effective. And so the goals to reach that objective include developing a service continuum that matches individual, family, and community needs, to ensure that services are desired, valued, and utilized, to optimize outcomes across the continuum, and to reduce racism and stigma surrounding addiction. So these 4 goals are really the goals that will help us achieve the objective of having the continuum of services that remedies systemic racism and is accessible, desirable, and effective. So the second pillar is focusing on the addiction services system infrastructure, accountability, and workforce. And the objective here is to have an addiction services system that is accountable for achieving optimal outcomes with and among providers and people served. And so the goals to reach that objective include promoting mutually respectful engagement, transparency, and accountability with providers and people served, increasing the number, diversity, and engagement of the addiction workforce, leveraging finances to optimize outcomes, and improving the monitoring and accountability of services provided under and within OASAS oversight. So again, these are the goals to achieve this outcome. I just want to also just say a word of, I know that, this is broad in a lot of ways, and what we're doing is also drilling down even further to say how are we going to meet each goal, but which then meets each objective. But for this purpose is here really sort of keeping it at a higher level, but just to know that we know these are broad, and we're digging down deeper as well to have really clear measures also of how we can keep ourselves accountable to whether we're reaching these goals and then these objectives. Slide. So the third pillar is focusing on the OASAS reputation, relationships, and outreach. And so the objective here is for OASAS to be recognized as the definitive leader on addiction in New York and to serve as a model for others. And so the goals are to be the acknowledged experts on addiction, to enhance a strong collaborative relationship with external government stakeholders, and then also to promote the success and value of OASAS, the addiction service system, and the people that we serve. Next slide. So the fourth pillar focuses on it's internal to OASAS, so it's the OASAS infrastructure and processes. And the objective here is to have an efficient and effective agency infrastructure and processes to improve operations. And so the goals here to meet that objective are to refine the data collection process to reflect the service continuum and to inform policy and decision makings, to automize, standardize, and improve our processes, and to modernize agency physical infrastructure. And a lot of that has to do with our addiction treatment centers. Next slide. So this is the final pillar, focusing again internally on OASAS. And so this is focusing on the OASAS staff, leadership, and agency culture. And so the objective here is to have an agency culture where people are engaged in the mission and feel valued. And the goals here are to create a recruitment process that's aligned with OASAS's priorities, and then also to foster an environment that is anti-racist and supports learning, engagement, and professional development. Next slide. So again, we really want to hear from you. I know, I went through that pretty quickly. It's at a high level. It's pretty broad, but we are drilling down from what we're sharing here to ensure that we have measurable outcomes to hold ourselves accountable to see if we are meeting these goals. These goals are really not specific to any one part of the addiction continuum of services, right? This is applicable for prevention, for treatment, for harm reduction, and for recovery. And it's also not, specific for any one substance or gambling, but really across the board for all substances and for gambling. So we, as I mentioned, have a draft plan that is available on the OASAS website. We absolutely want you to give us input, comments about that strategic plan. This is the QR code that will bring you there. And I'm happy today for you to put comments in the chat. And I will go through as much as possible. But really, really encourage you to also put in, written comments in that survey so that we can collate all of the feedback that we get and then modify and update the draft strategic plan. Next slide. So as you can see, again, these are the pillars with the people served and service outcomes at the center. The addiction services system with accountability in the workforce, sort of at the next layer, with our reputation with and relationships and outreach with providers, communities, people with lived experience, and other government agencies. Then internal is the, how we work at OASAS, our infrastructure and processes, to make sure that we're optimizing as much as we can our working processes. And then finally, our culture, staff, leadership, and really culture. And so we all know that addiction is a chronic disease and it impacts so many New Yorkers, and that we're losing far too many of our family members, friends, and neighbors to this overdose epidemic. And so this is a plan that really seeks to map out our strategies to ensure that services that are life-saving and improving lives, that these services are accessible to all. Next slide. So we have plenty of time for questions, comments, and please feel free to go ahead and put that in the chat. And again, if we don't get to all of the comments or questions, and even if we do, I'm also encouraging everybody to put your comments and questions in the survey that you can access by this QR code that's on our webpage. So the first comment or question from Will: this is my introduction to OASAS's strategic planning. I'm curious how it differs from the previous strategic plan, and what is OASAS most hopeful about and proud of regarding this new plan? So I'm actually going to hand it over to Andrew to talk about the previous, the strategic plan, because as I mentioned, this is required by mental hygiene law for us, for OASAS and other agencies, OMH, OPWDD, also to have their strategic plans every 5 years. And Andrew has been an instrumental part of this for much longer than I have been. So Andrew.
Yeah, I think the biggest difference is really the process. With this strategic plan, really started examining everything. I think in previous strategic plans, we kind of sort of took it for granted that what we're doing works and is good, and sort of talked about, well, how can we do more of it, or if we've spent our resources somewhere, let's organize that under a framework and keep going that direction. And really, for this strategic plan, we started from the beginning. You saw that Chinazo talked about, looking at the mission statement and the vision statement. And so that was probably one of the hardest parts, and that's where a lot of the work started. And so once we had that was our framework for the rest of it. And so then it was a matter of talking about what outcomes do we want, what does OASAS want to achieve, and then working backwards from that. And so everything sort of flowed from that. And so there's also a more, you see the word infrastructure in there a couple of times. There's also a focus on, if we want to achieve this, then what are all the things that we need to do first before we get there? Rather than just stating a goal of achieving this, realizing that, okay, if you want to, reduce overdose deaths, or whatever the goal is, there's things that have to happen first, whether it be a workforce that's ready, or programs that sort of incorporate harm reduction. All those things have to be in place to work up to that, rather than just stating that, or just stating the things that are doing. So really, I think the biggest thing was just the process of just starting fresh and really looking at what this agency wants to do.
Great. Thank you, Andrew. And then I think the second part of that question is, what are we most hopeful about and proud of regarding the new plan? So I think we've been, as you heard me say, our guiding principles are really about harm reduction, data-driven approach, and using an equity lens. And I do think that really calling out some of the harms that have been done in the past, particularly around race and racism and racist policies, you can now see reflected in the strategic plan. And so this is an area I'm proud of. It's also an area that's challenging. It's challenging to talk about. It's challenging. It's uncomfortable. But I think it's important that we do really recognize what has happened in the field of addiction, with a lot of criminalization in the past. And really, it has been, has been along the lines of race in this country, and really trying to think about how we can use an equity lens in what we do to make sure that we have equitable services across New York State. I think that is a really important guiding principle, and you can see that reflected in the strategic plan. I think also we're really hopeful about we're at a unique time in the field of addiction, where even though there's still a tremendous amount of stigma, I think so many people have been personally touched by addiction in their personal lives, where people are beginning to be willing to think about things differently and to do things differently. And so embracing sort of harm reduction in that is and really thinking about how we can best all work together, because we really need all of us to address addiction, to really be able to sort of bend the curve. So I think also we are looking in the mirror too. Some of it is a little bit challenging in the way that this agency's operated in the past, and really thinking about have we been punitive? Do we need to be more collaborative? Do we need, to have more of a partnership, and having those kinds of discussions? And so I think that, again, that people are willing to have different kind of discussions than in the past, and to think about things differently. And so that gives me a lot of hope about our future, and working together with all of you, and working internally in OASAS, as the world has really changed. And there are new opportunities that we have in terms of working together and really just improving the lives of people with addiction. So to me, that's really, I have a lot of hope and excitement about that, and really, look forward to the future and leading this agency in that way. So next question is from Helen or Skip. As somebody with who's on the LEAP, which is our Lived and Living Experience Advisory Board, or advisory panel, I see that the comment is, I'm completely disheartened to the fact that your Lived Experience Advisory Board has no input in the building of the strategic plan. So thank you, Skip. I think, I'm glad you're here. And this, as I had mentioned sort of early, this strategic planning process started in 2022. So it's been happening for some time. It's been a long process in which the executive team at OASAS has really spent many, many hours really thinking about our vision, our mission, and then what our priorities and goals should be. We are absolutely looking for input from the LEAP, from people with lived experience, from our providers, from communities, from local government units, from OASAS staff. So it's really a wide net that we're casting, and to really get feedback from both internal and external partners. And certainly, you know, making sure that we will provide the LEAP with a link to this so that we can get written feedback from everybody is certainly our goal. So we have tried to make sure that people are aware of this through social media, through webinars like this, you know, and inviting, you know, sending out invitations to this to all of our programs, again, local government units, to the OASAS staff, etc. So, you know, it may not be perfect the way that we're doing this, but we're certainly trying to reach as many people as possible who are impacted by addiction, who work in the field of addiction, to get input. So thank you for being here today. The next question is, will we send out the slides? So actually, better than sending out the slides is the actual strategic plan document, which is available again on our website to anybody. And so this is the QR code to that, and you can see that here is the draft strategic plan picture. But when you leave today's webinar, you will also be taken directly, when you close out this WebEx, you will be taken directly to the web page so that you can see the strategic plan. You can download it if you want. Next question from Tracy. I assume OMH, DOH, OPWDD, et cetera, have similar planning processes. Will there be strategic alignment across statewide departments, especially given initiatives to support individuals with co-occurring illnesses? Mental health, addiction, and physical health, and also given that many of us fall under many of these state agencies. So I totally appreciate that comment, and I'm actually going to pass that to Andrew, who has been working with our other O agencies, OMH, OPWDD, on a regular basis, exactly around this in terms of strategic planning.
Yeah, so first of all, and I'll say, you know, put out another plug for the full plan, which is on the website, because as part of this overview, and I think even on the initial landing page, when you go to our website, you see the priority outcomes and the goals, which is the highest level. And then once you get into the full plan, you get to the objectives. So under our, you know, right on our priority outcome of the continuum of services that remedies systemic racism and is accessible, desirable, and effective. So our first outcome, our first goal is to develop a service continuum that matches individual, family, and community needs. There's a goal right in there about people with multiple diagnoses. It's implement an enhanced approach to care for persons with other comorbidities and ensure that all New Yorkers have access to the full range of services. So I think that speaks in terms in general, of what this question asks about people who have addiction and also have other physical and other behavioral health concerns. And also just in general, in terms of the process, you know, we are, especially in the planning office, but throughout the agency, are really in constant contact with our partners at OMH, DOH, OPWDD, and, you know, the other mental hygiene agencies, OPWDD and OMH, and also the other agencies that people in our system touch, so OCFS and others. So formally, we have an integrated local planning process. So when local government units, which are essentially counties, submit their plans, their local plans, they submit them to the three of us at once. So it's not a separate process for each agency. It's one plan, and we encourage people to the areas that cross over to identify that as much as possible. And I know I see, even looking at the participant list, I see some of my planning colleagues from the other agencies, and we've worked together for years on this call, which I appreciate. And so that's also, too, as part of our state planning efforts, we all, you know, are tuned into what each agency is doing so we can align those as much as possible.
Great. Thank you, Andrew. And I just want to say, I mean, this is part of the work that we do across agencies with the strategic planning, but there's also so much more as well. We regularly meet with, and it's required by state law to meet with OMH and OPWDD to talk about cross-cutting issues. And so we do have regular meetings with those agencies and with the local government units. So it's sort of the county level to also hear from them in the, with mental health, developmental disabilities and addiction and that intersection. And then, we've certainly heard from so many people, and we know from the data about the increase in mental health symptoms, across this country and across the state. And we see that in our numbers in terms of the number of people with addiction who also have mental health conditions. And so we work very closely with the Office of Mental Health to really think about how we can incorporate really, addressing both mental health and substance use in both of our systems, so in the OMH system and in the OASAS system. And so things like, we provide scholarships to people working in the OMH system to become CASACs or, to become Sherpas. We're tripling the number of community behavioral health centers, so the CCBHCs. So those are clinics that are staffed to provide services to people with mental health and or substance use disorders. We have crisis stabilization centers, again, staffed for people with mental health or addiction-related crises. We're working together in schools around school-based clinics and integrating prevention efforts in that. We're looking at regulations and licensing to make it easier for programs to really be able to offer care for both mental health and substance use. So there's so many ways in which we are working across agencies, and that includes strategic planning, but it includes so much more as well, because we know that this is a big issue. So I really appreciate that question. So next, from Andrea, you mentioned there's a lot of detail missing. I see a lot of opportunity for the BHCCs to assist with the goals, since the state has already invested in the infrastructure and the BHCC's behavioral health community coalitions that focus on health equity, collaboration, and data-informed decision-making. And so what is the vision on how the BHCCs can assist in this plan? So I think, let me just say, I see a lot of comments right now about specific areas, so like families, people with lived experiences, the BHCCs. I agree with all of that. We want input from all, and I'm not going to necessarily call out one part of the communities that are affected, or one part of the state, or one part of the system. I mean, we want to hear from everybody. We're thinking about this very, at the state level, across services, right? Across the entire state of New York and all of the regions. And leveraging, you all who are here, and the advisory committees that we have put together, right? And our partnerships. And so we definitely want the BHCCs to get your input. As you mentioned, you are doing a lot of this work, and so we want to hear your input, and we certainly appreciate that. I think the larger question about how BHCCs fit into the strategic plan, so that's something that we're looking at and working towards right now, about how to really leverage the investments that we've already made and where they fit. And so, can't really talk about every single part, of the details of our system here, but please know that, we are thinking about how to really leverage the work that you're doing to, continue to inform how we're moving forward. Next question by Donald: what services will be offered to retain people in care while their substance use is active? So for people who fall out of treatment, what services and processes will be put in place to retain them in care while their use is active? So thank you, Donald, for this question. I think certainly this is about harm reduction. And as you heard me say, harm reduction is absolutely one of our guiding principles at OASAS. Since I started as commissioner, we created a new division of harm reduction. And really, our focus is twofold there. One is on working with the existing system at OASAS to really provide education and support and technical assistance to help programs incorporate harm reduction in their work. And that's something that we're going to be really expanding on, in the coming months and years. And then also about really thinking about different kinds of services to meet people where they are. And so I think this is also part of the question is, for people who are either fall out of care or never entered care, right? Because they're not ready yet. And going out and meeting those people where they are. And so that includes mobile units, that includes outreach under, on the corners, on the streets, under bridges, right? That includes transportation, that includes mobile methadone, so with our mobile medication units and bringing methadone treatment, for example, out to communities that don't have a brick and mortar opioid treatment program. That includes low threshold buprenorphine treatment so people can get buprenorphine treatment while they're in the parks, and having providers go into the parks, into the streets, into the homeless shelters, into the jails, into the courts, right, to provide treatment on that same day. So those are the kinds of things, is like the new initiatives to really go and meet people where they are, and then also to work with our existing programs to really help incorporate a harm reduction approach in their services. Okay, so next question by Michelle. I'd like to follow up on Skip's question. I don't see where the peer piece is in the plan and how it enhances the services that are provided. Peer-run agencies are important and need to be involved. Totally agree. Peer-run agencies are important and need to be involved. And as I mentioned, we're not singling out as one part of our system or one, portion of the community. We absolutely believe that people with lived experience should be giving feedback and input. That is why we're having this today, for that opportunity. That is why we have this on our webpage, so people can provide written opportunity. And certainly would love for you all who are here today to share this information, to share the link with your colleagues and networks. We also know it's important to include the family members and people who are working in the field, and other government agencies and local government units, right? So and OASAS staff, and right. So we really, we're trying to reach all of those who are impacted, whether personally or professionally, and get input. Next comment or question. I'd like to hear more about the plan for rural areas and smaller cities. I was born and raised in Western New York, and now a psychologist serving in on my county board in Central New York. And the scarcity and supportive services, the scarcity of supportive services persists. So what can the state do to help support aligning, I think, rural areas with the strategic plan? So as I mentioned, talking about equity, certainly a lot of that has to do with race and ethnicity, but it's not all about that. And part of that also has to do with rural areas and, other communities that are also at high risk of having harms from substances. And so one of the things that we're really doing is, when we look at the strategic plan, it's really about meeting the needs of communities. And part of that includes looking at how communities differ, and how there's unique challenges in certain parts of the state that are different than other parts of the state, and then being able to really tailor our approaches appropriately. And so one of the ways that we're really doing this is by taking a regional approach to the services, looking at our data, again, data-driven approach, as to what kinds of services are and are not available in each region, and then targeting our investments accordingly, right? So that if there's a quote unquote desert of recovery centers in one part of the state, making sure that when we put out an RFA, that we then target, that area for support to be able to, support a recovery center in that area that doesn't have access to one. So that's the kind of example of the work that we're doing, is really looking at ensuring that regionally that there's access to the full continuum of services, and using our data to help guide that targeted approach. So the next comment is from Will. I'm pleased to be supportive of OASAS and a part of this conversation. Thank you both for your answers. So thank you for your comments. And again, I think that this is really trying to cast a wide net so that you can hear from us directly, and again have the opportunity to have these discussions, and then to have your input written, and so that we can collate feedback from everybody. From Lisa, I'm very interested regarding including family services in the strategic plan. I do not see anything for inclusion of family services. Is there any plan to begin considering family services and supports in the recovery process? So, again, we're not specifying any one part of our system here. We think that the strategic plan is really for all parts of the system. And so we certainly recognize the importance of family services, and really include that in the broader umbrella of the strategic plan. When I think about family services, I certainly think about a lot of our prevention services are very family oriented, around parenting and families in general. And then certainly in with the recovery centers, really also we're having discussions about how we can not only support individuals in recovery, but their families as well, and bringing some of the prevention services for maybe the children of parents who are in recovery, and really thinking about how we can do a better job leveraging the work that's happening, and really providing the services across the continuum. So family services is definitely part of that. From Ricky, I'm a beginner. How do I get started? So again, going to our webpage, and you can scan the QR code, or when you close out this webinar, it'll take you there. So please, and obviously this is a lot of information. We don't expect that you're going to have all of your questions answered in the next, in a 1-hour webinar, but the survey for your feedback is open until August 31st. So you have a month where you really have the time to sit down and read the draft plan, think about it, and you can really then, put in a lot more of your comments. So again, don't expect that all of this is going to happen in a 1-hour period. You have a month to be able to really think about this and provide your feedback. And so again, I encourage all of you to also share this with your networks, because and your colleagues, your peers, because there's a lot of time where people can really take their time and think about things and provide that feedback. Okay, next is I'm curious about your intention to strategically improve recovery supports, to build more infrastructure around recovery as opposed to focusing on addiction treatment, and to forge recovery in the minds of many who continue to recycle through the systems of care. It appears that the focus on addiction treatment is that people automatically move out of treatment into society and do not need supportive services. Is this an accurate assessment? No, I mean, I all parts of the continuum are important. Prevention's important, treatment's important, harm reduction's important, recovery's important. And I wouldn't say one is more important than another. They're all important. And obviously, people have different needs at different points in their lives, right? And so we want to have a system that can meet those needs for all New Yorkers, you know, and depending on where you are on that continuum. So just also to give you, you know, and again, meeting the needs of communities, of individuals, families, and communities, that is part of our strategic plan, right? And so are there communities, for example, that have a lot of treatment programs but not recovery services, or a lot of prevention services but not harm reduction services, right? Those are things that we're asking, that we are looking at this regionally, because we want to make sure that, you know, regardless of where you live and regardless of where you are on the continuum of, you know, either gambling or substance use, that you have the services that you need in your communities, in your regions. And so, so we are exactly looking at this to make sure that there is equity in terms of the whole continuum of services. You know, I just want to give some examples of the ways that we've recently supported recovery is through the opioid settlement funds. We increased the dollars going to all of the recovery centers across the state. And not only that, but we did it equally. So in the past, and this is like years and years in the making, certain recovery centers had budgets that were much, much larger than other recovery centers. Why? I don't know. But, you know, again, using an equity lens, you know, we really wanted to make it more equitable across the state. And so the budget now for all of the recovery centers is equal. And, you know, we heard a lot of positive feedback about that. And so now the recovery centers can hire more peers, and peers can go into courts, and peers can do, you know, more outreach in the communities, right? This is the kind of thing. We also are working on recovery housing. So that's another big area that, you know, we just changed our regulations. And this is a big new area for OASAS in terms of really thinking about how we can support recovery housing, bring that under our umbrella, have clear standards, and provide, you know, financial incentives for people to sort of come under the OASAS umbrella with their recovery housing. So, I mean, so those are just off the top of my head, some examples of the ways that we are supporting recovery in our system. Okay, so next is, you indicated in your mission statement that OASAS envisions that people in New York impacted by addiction will thrive and lead healthy lives. In your experience, employment and having a purpose serves a great impact to foster a healthy lifestyle. Employment is also a data-driven social determinant of health. Rehab counselors are trained, yes, to do this, but we chose to cut the valuable service from the OASAS budget. Do we not believe employment's important? How do these critical employment services fit into this new innovative strategic plan? So thank you for that question. So we had budget cuts this year that, you know, are difficult to deal with, but the reality is that's the reality. And so vocational rehab services were cut. We also heard very loudly and clearly from providers about how important this is. We totally agree. It is important. It's absolutely important part of the recovery process. I don't disagree. I 100% agree with you. And so hearing, you know, from the providers, we, you know, made a change, and we are continuing to fund the recovery services for this fiscal year. However, when we took a deeper dive into, I'm sorry, not recovery services, our vocational rehab services. When we took a deeper dive into our vocational rehab services, what we realized is that there's really an inequitable distribution of these resources. So both geographically across the state and in our system. So for example, a lot of services were happening in New York City and not nearly as much upstate. That's an issue, right? We also know that a lot of these services were provided in a specific part of our system, and not in other parts of our system. So for example, in, you know, our residential programs, but not in our outpatient programs. So we're taking this as an opportunity to really rethink about how we could have a new model that is that provides these services more equitably across the state. So we are working with providers. We've invited all of the providers who have funding for this to meet with us to talk about what a different model could look like, where we have more equitable distribution of these resources. So that is where we are right now. And I know we have meetings on the calendar, planning to work with providers to really think about a new model of providing these important vocational services, vocational rehab services in the OASAS system. So more to come on this, but really thank you for that question. So next from George, so glad to see an emphasis on data-driven approaches and harm reduction as foundational underpinning. Important to keep a focus on overdose prevention and safety planning in order to prevent events and deaths. So thank you for your comments, and definitely hear you in terms of overdose prevention. Certainly in terms of harm reduction, so much of our goal is really to keep people alive, right? Period. And then when people are alive, they have the opportunity to do many other things in their lives. And we know that the drug supply is so deadly. And so really trying to think about resources, about making sure that people are aware of how deadly the drug supply is, right? It's not just heroin, it's stimulants, cocaine, and methamphetamine, it's counterfeit pills. And so really making sure that communities are aware of this is something we've been really focusing on, making sure that people have the tools that they need that are life-saving and evidence-based. So really expanding naloxone distribution. So we, had distributed over 110,000 naloxone kits and have made on our webpage an easy portal so that people can spend 15 to 30 seconds online, put in their information, and get naloxone shipped out. We're the only state in the country doing that, making it so easy. And then along with fentanyl test strips and xylazine test strips, and we've shipped out over 16 million xylazine and fentanyl test strips. So I hear you. We definitely focused on this. We've done a lot to again improve awareness, and then ensured that resources, life-saving resources and tools are available to New Yorkers. And I'm really proud of the work that we're doing in this area. Okay, I'm curious if this plan outlines its expectations for the other O agencies, or outline how the O organizations will work together to address the needs. So the recent local services bulletin provided by OASAS was a good example of this. Yeah, so thank you for this comment. So I know, so Andrew sort of touched on this, how we are working with the other O agencies, OMH and OPWDD. They also, because they're under mental hygiene law, are also required to have a strategic plan. And then we work really closely with the local government units, so at each county, as well as their plans, folds up and definitely impacts our plan, which obviously makes sense. So hearing from all of the counties about what they're focusing on, and we do that together with the other O agencies, working with the local government units, the directors of community service in each county. And so it's sort of cross-agency and cross-county to state. And so these are ongoing, regular meetings, regular processes that we have so that we're not working in silos, that we're really, our work is informing each other. Andrew, anything more to add on that?
No, just again, another plug to read the full plan, because we do talk about our agency partners, our federal, state, and county partners as one of our priorities. So So we talk about at the individual level about, people who have multiple, multiple challenges, and also at a agency level about working across the different agencies.
Great. So I'm just looking at the time. It's 12:58, and I really appreciate all of the comments. I appreciate all of you for joining us today, and again, want to encourage you to provide this feedback in writing with this survey. So I see some of you have asked about how to share the QR code with contacts. So what I would say is actually when this ends, you will be brought to the website that has the strategic plan and the survey. So you can, share that link or that, the web address with your colleagues so that they can have access to the strategic plan and to the survey to provide feedback. Again, the survey is open for feedback through August 31st. So people have a month to really think about this and provide your feedback, and really appreciate you sharing that with your colleagues, because again, we want to cast a wide net and hear from people with lived experiences, families, providers, other government units, etc. So thank you all again for participating, and we look forward to seeing your feedback in writing. Thanks so much.